Hi, I'm Dr. Chinelo Okoye, and today I'm going to be talking about irritable bowel syndrome. Irritable bowel syndrome or irritable bowel disease is a condition where patients have chronic abdominal pain, changes in their bowel habits with no organic cause. It is a diagnosis of exclusion. So what this means is that the patient will need to have a detailed evaluation, ruling out all the other possible causes of their symptoms before the diagnosis can be made. There are three subtypes of irritable bowel syndrome which correspond to the gastrointestinal symptoms. So there is constipation predominance, which means that the patients will experience mostly constipation in addition to the abdominal pain. There's diarrhea predominance, which is mostly diarrhea in addition to the abdominal pain. And then there's a mixed picture, which is where patients can have a mixture of constipation and diarrhea in addition to the abdominal pain. In addition, patients can have periods of normal bowel habits alternating with either the constipation or the diarrhea. Now, regarding the abdominal pain, patients tend to describe it as crampy. It's usually present during the day. In fact, some patients notice that the pain is worse when they first, some patients notice the pain more when they first wake up in the mornings. The pain can be exacerbated by stress or by eating, and the patients tend to notice that having a bowel movement often provides some relief. The constipation is usually described as hard stools or just a difficulty having a bowel movement in general. Patients may also experience that they have a feeling that their bowels are not completely empty even when there's nothing in the rectum. The diarrhea is usually described as frequent loose stools that can be small to moderate volume. The stools usually happen during the day. The diarrhea usually happens during the day. Patients will often experience abdominal cramps followed by the urge to go defecate. They'll have the diarrhea, and then they may experience this same feeling of not completely emptying the rectum. Other gastrointestinal symptoms that are seen in irritable bowel syndrome are things like heartburn or gastroesophageal reflux disease, difficulty swallowing or pain on swallowing, abdominal bloating, gas, and feeling full early, so things like that. And then there are also non-gastrointestinal symptoms that can be associated with irritable bowel disease. So for instance, things like problems with sexual activity, painful sexual activity, frequent urination, pelvic pain, and other type of pain syndromes in general. So now I want to shift gears and talk about some of the symptoms that should not be seen in irritable bowel disease. So the presence of these symptoms should prompt further workup for a possible cause. So nighttime symptoms, abdominal pain that is worse at nights or wakes the patient up from sleep at night. Nighttime diarrhea, large volume diarrhea, abdominal pain that is worsening, bloody stools or greasy stools. Patients who have a family history of certain inflammatory bowel diseases or certain type of gastrointestinal cancers. Patients who have lost weight or who are malnourished or who have unexplained iron deficiency anemia. The presence of any of these should prompt a little bit more investigation for any identifiable causes. Now, regarding treatment options, your doctor will probably recommend a combination of medications as well as dietary changes. The key is to see your physician to make sure you have a detailed evaluation to rule out all possible causes of your symptoms before the diagnosis can be made.